I'm privileged. I don't have to worry about getting enough financial resources to take care of what I need. Families like ours will say you're privileged, and you have responsibility to do better for others. So we devoted all our family assets towards hopefully positive change. People have many different needs, and not any agency can do everything. So the way that we thought I can bring value has become more of a change agent.
As Singapore grapples with the challenges of an aging population today, Dr. Mary Ann Tsao has been ahead of the curve in terms of searching for solutions as to how to grow old with dignity. 30 years ago, she pioneered a care model for the elderly that was the first of its kind here. It was based on the idea of social medicine, that a person's health outcomes are often shaped by their social circumstances, such as poverty or gender. Known today as integrated care, it is at the heart of elder care services in Singapore. And the Tsao family name has become synonymous with innovative, elder-centric programs. As I see my loved ones age, I wonder what my later years would be like. And so, I'm curious to learn more from Mary Ann about what it means to not only live longer, but to also live well.
Hi, Mary Ann. Thank you so much for having me.
Oh, absolutely. Welcome.
I'm so looking forward to talking to you.
Well, I look forward to our conversation, so please come in.
Oh, thank you. What a beautiful house. Thank you so much for seeing me today, because I understand that your schedule is packed full with traveling all over the world. Where have you been recently?
I just came back from quite a long trip from here to Helsinki, New York, Boston, and back. I do travel quite a lot for different international boards and some of our family business, so...
Yeah, it does seem that traveling has been a big part of your life. So can you tell me about your early years in Hong Kong and why you left?
Actually, my parents left Shanghai in the 40s. And in those days, of course, being a business family, capitalists, we were all fleeing. So we actually have a bit of a refugee mentality within us. I was born in Hong Kong like my siblings, and then I was sent from Hong Kong to the US when I was 12.
Wow.
And I remember when at the airport, I was so clueless. I have no idea what's going on. My mom gave me and my brother a stack of comics and a bag of candy. We're happy. Thinking, this is cool. And then in Davis, California, that's when it hit me. Gosh, my life will never be the same again.
Wow.
Yes, I remember crying at night. I was sleeping on a couch crying. And the next morning, I remember thinking, well, you just have to deal with it. So, like that.
Wow. And was it hard to deal with it?
In Hong Kong, we were pretty coddled. I mean, you just have to go to school, be a good kid, study well. But in California, of course, all the kids, you have to earn your pocket money. I picked fruit, I mowed lawn, I babysat. I did all kinds of stuff. It was 50 cents an hour in those days. I'm sure if I just grew up in Hong Kong and, being well taken care of, it would not have served what I needed for myself for the rest of my life. I learned to go after things I wanted, or just figure out how to get it. You become much more resourceful.
Yeah, definitely.
That way.
Wow. And when did you move to New York?
I think I ended up in New York in 1979 for training.
Right.
Yeah, and I was very lucky. I was applying to a pediatric training program. Somehow my application went to this other program, and it's called social medicine. That program basically taught doctors to think holistically. This program put us in a clinic in the middle of South Bronx, in the poorest of the poor neighborhoods. No one cared about what happened to them. It was very poor. And you really get to see what happens to people. People come to emergency room. They come in with a lot of terrible illnesses. They come with terrible accidents. They come in with gunshot wounds and stab wounds and drug addictions. But I learned a lot from that. Yeah. And so I think this is how it helps shape how I think about healthcare. So you really have to understand who the person is, who this family is, before you can really prescribe anything.
Yeah.
And this is one thing that I find that health systems don't understand, is that people live in the community, in the family. Social factors really impact them very much. Social medicine is really about healthcare delivery within a system that must function. And if it doesn't function, then you have to be an agent of change to try to address some of those issues.
Your grandmother essentially
Yeah.
gave you the opportunity to come back to being a change agent.
She's an older person in a modern society, and she thought that modern society is unkind to old age,
Okay.
and she wanted to do something for older people. What she wanted for them was just to be able to live in their own home and be able to be surrounded by people that they care about and care about them, and to always be the master of their own destiny, make their own decisions. So this whole advocacy about aging in place, which has started in 1993, was really the notion that we had to create services in a community to support older people's care needs, make the environment more friendly. Sometimes I think the heavens actually smiles upon me. By then, I was outgrowing my private practice. I was single in New York, very good. But I felt like that wasn't my calling. So my grandmother said, well, come back and do this. When I came to Singapore, I realized in retrospect that was really, those experiences really helped me to create the kind of service that we innovated, because you take into consideration the full set of circumstances when designing a service. And you have to think about systems change.
Up next, Mary Ann shows me what her vision of successful aging has evolved into today. Mary Ann Tsao is an emigre from Hong Kong who moved to the US as a child. After working as a doctor in New York City, she was asked by her grandmother to help set up the Tsao Foundation in Singapore to address the social challenges of aging.
Uprooting your life again to move to Singapore in your 30s. What was that like?
Yeah, that's maybe the refugee bit of me helped. Yeah, that was a mixed feeling in the beginning. Because I didn't know anybody here. There are times I felt like, gosh, maybe I can't do this. I've never set down the foundation before. I've never worked in Singapore before. I've never worked with older people before.
Yeah, from pediatrics to geriatrics.
So some years later, this lawyer friend of mine told me that the word about town was some rich girl from New York dabbling charity that won't last very long here. I just thought it was pretty funny. Some rich, I got lasting power.
I think that's great. And so tell me, what was the reasoning behind the foundation being based in Singapore?
My grandmother felt that Singapore is a really good place. Hong Kong, of course, is 1992, moving towards 1997, going back to China. This is on the heel of 1989 Tiananmen Square. So, she's quite sensitive to this geopolitical situation.
And the organization, the Tsao Foundation itself, is pretty different from many other charitable organizations out there.
In those days, there were very few nonprofits working in aging. It's a small handful. But in Singapore, most of the nonprofits I looked at tend to be service providers. See, American foundations kind of help to inspire what I did here, because those foundations tend not to be service providers, but be catalysts of change. So that's a model that I brought back, thinking about a service delivery, not just pieces of service disjointed. Take a population health approach, think about a whole community, and rejoin all the dots of different providers and create a system. We found from a population point of view, a lot of significant issues. 25% older people have never seen a doctor, don't want to see one either. You're going to have to find them.
Yeah.
They're not going to come to you, right? Second thing was that there are 10% people with dementia, and 54% of them were socially isolated. That was shocking.
54 is more than half.
More than that was very shocking.
Was that difficult for people to understand at the time?
Totally. To this day, people find us hard to understand.
Okay.
Yeah. I remember like 2012, 2013, the ministry wanted to scale. They literally come to nonprofits and say, we need 50 day centers. How many do you want to do? 5, 10? I said, we only want to do one, really good one. So I felt like we were being kind of sidelined because we didn't belong. People made fun of us. Oh, this is Rolls-Royce care. This is Tiffany care. You don't let people deter you if you know what you're doing is right.
Yeah.
The way that I can bring value has become more an innovator, to be able to see what the needs are and then be able to identify and elucidate an issue. So older people stuck at home, not be able to age in place was clearly an issue. So that's why we start to create this thing called Community for Successful Aging in Whampoa.
To help me better understand the Foundation's vision, Mary Ann takes me to that very first project in Whampoa. Today, the Community for Successful Aging, or ComSA, serves over 9,000 residents in the Whampoa Bendemeer estate.
ComSA is a concept of keeping a whole population healthy, but then they need also a service center. So therefore, you need a cluster of services that take care for the very healthy to the very, very frail in one place. So it makes it very convenient for older people. But of course, we're in the community, in the CC, so kind of see what's going on. It's easy for us to respond to the needs of the community, the older people in the community. So this is EPIC. This started years ago when we started thinking about what happened to frail seniors, those with dementia, in a wheelchair, and oftentimes end up nursing home prematurely. So I think that one is keeping people out of nursing home, two is keeping them as healthy as we can, and three, keep them physically strong and socially connected. Yes, this is our sort of a pilot clinic. The idea is that the seniors that come to us, this is their home. We kind of really help them to organize all the medical, health, social care, everything.
I want to understand more about what it took to get to this point, from when the Tsao Foundation began its work 30 years ago. So I speak with a veteran who was there with Mary Ann from the very start.
You were one of the very first social workers with the Tsao Foundation.
She interviewed me for the job.
Oh, wow.
I thought, well, this is interesting, you know, the service that they wanted to start. And so I thought, oh, why not?
So what was this first service that you started with?
It was the Hwame Mobile Clinic, and it was a service that was set up, what we call home-based health and social service for older persons who are homebound. At that time, it was already quite innovative. The combination of the staff is already multidisciplinary. You basically cover the health as well as the social aspect of care. Nobody had that kind of service. And to have a health and social service going into the home of the elders, I mean, that's also something very new. From that perspective, you can say that Tsao is really the forerunner of integrated care. If you look at the scene now, you know, integrated care is like the thing to do, right? You cannot do without what we call the BPS care, which is biopsychosocial care.
Biopsychosocial
aspect of care. That means really you're looking at that person from a whole person perspective.
Right.
30 years ago, we were already trying to do that.
Aged care wasn't so much of a focus in Singapore.
30 years ago, I don't think, you know, people are so aware that eventually Singapore is going to be like a really moving very quickly to become a super aging society. There are some services in the community, but by and large, it was quite a blank space, actually. You can see from the way the Tsao Foundation is organized that it is meant to really tackle that systems change kind of thing. So I think it's amazing. I think she is a visionary.
And I'm also curious, like, would she get her hands dirty? Would she get on the ground with all of you?
During those years, we also run an eye screening service for older person, you know, especially for those older person who cannot get out of their house, right, homebound. One year we had it at a community center. We had to set up mobile toilets. Marian herself went and cleaned those commodes.
Oh.
You know, I was thinking, wow, you know, I wouldn't even want to do that. But she rolled up her sleeves and she did that. And at that time she was the president of the foundation, right? And that really impressed me.
As we spend the afternoon at ComSA Whampoa, I must say I've never seen so many happy seniors in one place. Even though I'm not quite one of them yet, I feel the sense of community that Mary Ann's efforts have achieved. Coming up, I find out more about Mary Ann's latest philanthropic ambitions, and they aren't limited to Singapore. Dr. Mary Ann Tsao spends 30 years pushing her vision of successful aging in Singapore, tapping on her unique position as both a physician and a philanthropist to catalyze wide change. But of late, she's been looking to expand that impact beyond Singapore. I'm visiting her at the Tsao family office to find out more. It's here that she pursues international philanthropic initiatives with the likes of the UNHCR, the United Nations Refugee Agency.
What is the Tsao family office busy with nowadays?
In addition to the foundation work for my grandmother around aging longevity, there's new ones for the family.
So there's
It's
a new
family
foundation.
foundation, a new Tsao family foundation that's being set up. So I'm kind of busy with that.
Right, and what is the focus of this new foundation?
We're still trying to figure it out because I think it has to cater to the interests of the whole family. It's really about the theory of change. We focus on something that long-term can create change in mindset and change in systems. UNHCR that came to us, we have given them some money before for immediate humanitarian needs. I think moving forward, after crisis, there's post-disaster reconstruction. So we were just trying to explore, is there any area that can support them? We also have colleagues from the Tsao Foundation that work with aging to say, is there space for us to provide some technical input as well, such as what happens to older people in crisis? The Tsao Foundation has always had regional aspirations, but now I think there's a lot more space to work in a region because it's good to fly the Singapore flag outside as well. Population aging is coming fast and furiously in the region. They're not well-resourced like Singapore. So Singapore already have like 30 years of experience that I think is really important for us to share for the region as well. To me, if it's something that's useful wherever I belong, at this moment belong in Southeast Asia, then I think the work should benefit across the board for people in Southeast Asia.
This conviction to make a difference in Singapore and beyond has been an inspiration to another civil society pioneer, Mary Ann's old comrade in arms, Dr. Kanwaljit Soin.
So you've known Dr. Mary Ann for 32 years now.
I was on the Tsao Foundation for a few years, so I saw at a close distance what the foundation stands for and how she executed. The one memorable project that we worked together was the setting up of WINGS, the Women's Initiative for Aging Successfully, where women in Singapore, they can join once they are 40 years old and learn how to live well and age well. For women to form close friendships and support each other and have buddies, they need other women on the scene. Yeah. Men are fun, but for other things.
Okay, moving on. You mentioned that Mary Ann has been an inspiration to you.
She's not only a national figure, she's an international figure. She works in the region, she works with WHO, so she is actually a treasure that Singapore has managed to appropriate without really nurturing her. As Singaporeans, we have to salute people like Mary Ann who come to a country and then give more than some of us Singaporeans do for the country. So for that, we really have to salute.
What is the Tsao Foundation busy with nowadays?
Oh, we have a new thing.
Yay.
I think basically after 30 years of doing elder care in the community, the one last very big piece is older people, income and work.
Oh.
The 100-year life is here to stay. So we retire at 60, you have another 40 years. You're not going to have enough money. However, they're still not getting the job they need. And I think that definitely there's ageism, there's no doubt. We did our study, we found that old people don't get the job advancement because they didn't get the skills. And they just stopped training them altogether. Because the moment people shut off their mind about what older people can do, immediately opportunities just got cut off. So we need to try to tackle this problem.
Having called different places in the world home and worked and lived there, do you think those diverse experiences lend themselves to your work?
Oh, absolutely. I think for my work and for my life, being exposed to different ways of life, different culture, has been one of my greatest advantages that somehow haven't bestowed upon me. Not being Singaporean in many ways allowed me to see things from a different perspective and think out of the box. Psychologically, I'm not boxed in by rules that I didn't know. There are social rules that, of course, people in Singapore would know, but I didn't know what they are, so I would just break them without knowing that I broke some kind of social norm. As a nonprofit who aiming to create positive change, change almost always means you have to break rules, think out of the box, and things like that.
Looking back on your 32 years in Singapore, do you feel that you've managed to leave your mark in some way?
For me personally, I think the foundation had done a couple of good things. Aging in place in Singapore is now normal. The policy supports it, enables it. It's not normal for a lot of other countries. Okay, so Singapore not being seen as being very advanced because they have these policies. I felt that we worked very hard to cause that mindset shift. Over the years, been able to convince influential thinkers that the future of aging is not like it today. So I know that we, somewhere along the line, had something to do with those switches. There's something that Singapore does very well, is invest in today. But if you want to take advantage of that living the long life, the longevity, you must provide opportunities and invest in it.